You go. Good. Okay, now I'm going to talk a little bit about the TFCC, the triangular fibrocartilage complex, which is a complex of articular disc, meniscus homolog, and ligaments, along with the extensor compartment, extensor carpi ulnaris tendon. So there's these ulnar triquetral ligaments. There's all of those structures in there, and they can become injured. And usually when you injure that, it hurts with either radial deviation or ulnar deviation, sometimes for both, depending on what exactly the injury is. Now, that can be extremely painful problem as well. But part of the reason why it's so painful is because that dorsal branch of the ulnar nerve is wrapping around it. The other thing that I want to bring up is sometimes when I look at that TFCC, that whole complex of ligament, tendon, meniscus, articular disc, there's nothing wrong, but the pain is still severe and you still have the same symptoms. And what I find is about more than half the time, the injury is not in the TFCC, it's an irritation of the ulnar nerve, that dorsal branch of the ulnar nerve splitting off and innervating right in that tip of that ulna. It's the tip of the ulna pain, so ulnar styloid right here. That can be a nerve, or it could be the TFCC that needs to be evaluated clearly. And we have good treatments for both. And it's not unusual to have both. If you have inflammation in that TFCC, it's probably going to irritate the nerve. So it'd be unusual to have a TFCC problem without an ulnar nerve problem, but it's also not unusual to have an ulnar nerve problem without a TFCC problem. And it's hard to differentiate clinically without really looking inside. So what we do is we'll hydrodissect the nerve as it comes around and becomes the dorsal branch of the ulnar nerve. Ulnar nerve covers the dorsal and the ventral aspect of the hand, which is different than the rest of the hand. On the rest of the hand, the radial nerve is the back, and the median nerve is the front for the most part. There's some tip of fingers difference, but so we can address that very, very clearly by hydrodissecting the nerve, and then with a high resolution probe, we can put better than a tenth of a millimeter accuracy, put a solution into the area that's not healing, and stimulate that to heal where it wouldn't heal on its own. So that's after that we may do some taping to support the structure and also to help the nerve get a better circulation. So that's our TFCC, dorsal branch of the ulnar nerve solution, and I know this is going to be a common problem for a lot of people, so hope this helps out.